We are joined now by CBS News medical contributor Dr. David Agus. David, good morning. Health experts were forecasting and anticipating this as the country reopened. What do we do to keep those numbers down, and should some places reconsider reopening further?
You know, it's going to be hard to reconsider opening. I think we've been indoors for a long time, but we need to change our way of life. I mean, if there's one thing we could all do that would decrease the spread of this, it's to wear a mask. We have to create a new social norm, which is wearing the mask. You know, in countries like Japan, it's no big deal because they were used to wearing a mask. Here, this is a big deal, and we're asking the least affected, the 20, the 30, 40-year-olds, to step up to help others, and that's new for our country.
David, there's been a lot of concern that the widespread protests could contribute to a spike. What do we know about that? Is there any evidence that's happening?
Yeah, I think we're seeing little bits of it now. We're going to see more of it over the days to come. And, you know, many at the rallies were these 20 and 30-year-olds. They're going to go home and they're going to bring it to the people in their household, you know, mother and grandma and father and grandfather and next door neighbor. And that's what we worry about. I don't worry about the 20 and 30-year-olds because they're not going to get very sick in general. There are clear exceptions, but they can spread it to others who are more vulnerable. And that spike in hospitalizations is going to continue to rise over the next several days as a result of the protests. And it's not just in the big cities. Remember, people went from small towns to participate in larger towns, and then they went back to their hometown. And we're going to see spread in smaller towns that weren't spread before.
So should they quarantine after being at a protest, David?
I don't think they should quarantine. I think it's a little aggressive at this point to do that, but I do think they should all wear a mask. They need to block the spread of droplets from one person to another. We have a new way of life these next months until a vaccine comes. You know, everybody knew what to do during the lockdown. That first inning, we were good at it, but the second inning is fuzzy, and we need to behave differently. And wearing a mask is different. It's not in our DNA to focus on others, but we need to.
You mentioned the vaccine, David. What's the latest on developments in vaccine?
Well, I'm smiling. I think that the data so far in the lead candidates is very encouraging. And so I really think there's a possibility that in early fall, we will have vaccine candidates for healthcare workers, for the highest risk individuals, and then more as the supply increases. But the data so far look encouraging, and there haven't been any backward steps, and that's exciting.
No, that's very good news. All right, Dr. David Agus, thank you, David.